Committee for the North Carolina Retired School Personnel. And we have today with us a delightful speaker because I've seen her present before, so I can vouch for Jeanie. She is the Field Operations Manager for what we call SHIIP, which is the Seniors Health Insurance Information Program. So thank everyone for being here. Thank Carol for being here as our support personnel. And Jeanie, it's all yours for the next hour.
Thank you, Lavita, for that wonderful invitation and happy hump day. I'm happy to be with everybody today. We're halfway in the work week, and so it's just downhill from here. And as we were talking, I hope you guys are able to stay cool. And Carol, thank you for being my Vanna today and helping with the tech part of it. Carol and I go back a few years when I've actually attended the statewide conference, and we were just talking about that. I was not able to be there this year, but hope to be back next year. It's a great group to be a part of, and I even see some people that I know from when I was in school, and that's always nice. So thank you guys for allowing me the opportunity. Now, Carol, I have a couple of documents pulled up. Oh, I see the share button down here. So you must have read my mind. Thank you so much. And you
And
all,
so
my computer, my laptop is a little, um, I'd say possessed, and I'm going to stop my video so that that helps with the bandwidth. Um, so if you are able to see something, let me know. But if you're not seeing something, then let me know that as well. So I see a green outline. So hopefully you guys can see a document that we call the Medicare Basics. You all see
Yes,
that?
yes, we
yes, we
can.
see.
Wonderful. Thank you very much. And that pane to the right for editing, I'm not sure where that came from, but we'll just try to pretend that it's not there. So, how many of you, a virtual show of hands or just a show of hands mentally, are familiar with the SHIP, SHIIP program? Oh, wonderful. I see some of you raising your hand. So SHIP with two I's and a P. I tell people it's like a boat, but it's better to see you with because there's two I's there. Stands for the Seniors Health Insurance Information Program. And we are a division of your North Carolina Department of Insurance. So we are a state agency. I, like you, am a state employee. Will be a state retiree within a few years. But we were created back in 1986, and actually in September we will be 40 years old. And next week, next Wednesday, I will actually be headed to Greece for a cruise. I will be celebrating my 30th anniversary with SHIP and the Department of Insurance. So that tells you how much I believe in what we do and how passionate I am about our program and its mission. So I want to give you a briefing of our program just in case you haven't heard of us before, or you have, but you're not sure exactly what we do. So SHIP is a state agency that was created 40 years ago to help people with Medicare questions and problems in a neutral, objective, and unbiased fashion. And what does that mean for you all and our clients? It means that we're not insurance agents and we don't sell insurance. We don't receive a commission. And not that that's wrong or bad. That's just not what we do. But we are to provide neutral, objective, and unbiased counseling and assistance to clients at no cost. And the reason we can provide services at no cost is because we receive both state and federal funding that we are very thankful for and appreciative of, especially in this day and time when, there's a lot of cuts. And our program has been on the chopping block, both on a national and state level. Within the past couple years, actually, and thankfully, we've had people to rally and defend what we do, and it's proven successful. So we're very appreciative of that support. I tell people I can't imagine there not being a program like ours that does what we do. Calling 1-800-Medicare is great. They're nice people and they are helpful, but it's just not the same. And so our program just adds a little special added local statewide touch. We provide services in a confidential manner. So that means that any medical or financial information that we collect to assist people is not shared with anyone else. We're just trying to ascertain information so that we can best assist that client, as we know that everyone's needs are different. Everyone's financial situations are different. And so we want to make sure that we've got a good, clear picture of that client situation so that we can best assist them. And our goal at SHIP is that people have the best coverage related to their Medicare at the best cost or an affordable cost. So that's what we do. How do we do all these
Jeannie,
things?
excuse
Yes,
me, you have
ma'am.
a hand up. Mary Ann has her hand up.
Oh, yes. Go ahead, Miss Marianne. And I see Marianne's in Greensboro too.
Oh, I'm sorry. That was a just raising a hand to what
Oh,
you were saying, not a
you
question.
just you just wanted
Thank
to wave. Thank you, Marianne. And thank you, Carol. If you have questions throughout, please let me know because we can entertain questions. If it's relative to what we're talking about at that time, if it's something that we're going to be talking about later, I may say, keep that thought, and when we get to that area, let me know and we'll address it at that point. So thank you. Um, so
You have a
we,
couple more hands that just came up too.
yeah, of course.
Patricia Reagan, Chatham County.
Hey,
Can you
Pat.
can
Chatham's
you
one of my counties.
good? Can you increase the font so that we can see what is
Hmm.
written on your share screen?
Let's see if I can do that.
Thank you.
Is that any better? I try to keep the document each page on a like all the entire page on there. So that's probably is about as good as I can do and keep it one page on the screen. Is that better? And I did get rid of that extracurricular stuff to the right side.
You've got a plus sign just above the document. That might increase it a little bit.
Okay, let's see.
That in your toolbar.
Yeah.
It says 53%
I
now, right? Just above
yeah.
the word basics.
When I expand it though, guys, to 100, what happens is it the document, the page goes like we can't see the entire page. Does that make sense? So if I increase it to 100, it's going to throw this page uh, onto like so that we won't be able to see the entire page at one time. And my let me try to move this because my there we go. See if I increase it to 100, it throws things off. And if you prefer that, then we can do that. I'll just scroll down, but you can't see the entire page at one time. So as long as you're okay with that, you're the customer. As long as you're okay with that, I'm good with that too. So anyway, this just tells you how we do what we do. At the top, you'll see our 855 number. That is not just a SHIP Medicare number. That is a Department of Insurance number. So for those of you that also have homeowners insurance, or life insurance or health insurance that's not Medicare related, car insurance, you may call that 855 number Monday through Friday, 8 a.m. to 5 p.m. And there are live Department of Insurance staff members that are there answering your call, and they're based in Raleigh. So they're local. So give us a call and hold on to that number because I'm sure at some point or another, I know my family members ask me questions about automobile insurance or life insurance, and I'll say, guys, that's kind of out of my realm or my scope of knowledge, but here's a number that you can call. So that's a good number to hold on to. And then we've got a wonderful website that's listed, www.ncshiip.com, and that takes you directly to the SHIP website, not the Department of Insurance website. And there's a lot of good and helpful information out there. I don't know if you guys have heard about this requirement that agencies, especially state and federal government agencies, we have to have information on our website conformed to accessibility requirements. It was supposed to be in April. They extended that till next April. So I tell people our website's under construction, and you might see something on there today, and tomorrow you might see it differently or it might be gone. So just keep that in mind. But our website has some very helpful and useful information. And actually, there's a link to the State Health Plan website with some State Health Plan documents there that you might find beneficial. So that's how you can contact us. And our communications specialists in Raleigh are there just waiting for your call Monday through Friday, 8 a.m. to 5 p.m. We also have things in our office that we can mail out. We are trying to be conscientious about printing and saving trees, which would save money and mailing cost. So if there's something that we can refer you to online, you're going to get it immediately and be able to print whatever you need. Plus, we are saving printing and postage costs. And, that's kind of important. I like paper copies of things, but when I think about it, I'm like, oh, well, me getting it electronically is saving some money. So, if possible, I like to do my part in helping with that. The beautiful thing and the unique thing about our program is that when we were created back in 1986, we were the second program like ours in the country, only to the state of Washington, to have a program to help people with Medicare questions in a neutral, objective, unbiased fashion at no cost. And in 1992, the federal government had been watching us for 6 years, and they said every state has to have a program like North Carolina to help people with Medicare questions. And so SHIIPs evolved across the state, and that's a SHIIP with one I, a state health insurance assistance program. That's what we're all called collectively. But each SHIIP, SHIP, in every state has their own name, and our SHIP, SHIP, has the name of the Seniors Health Insurance Information Program, which has two I's. Virginia is called VICARE, Florida is appropriately called SHINE, and my favorite is the state of Ohio, and theirs is called OSHIP with a P at the end. So what do we do that's a little different? We have the office in Raleigh, which is great, but we also expand out into the local communities. And in most counties, I know Yadkin, we do not currently have a coordinating site, but in most other counties of North Carolina, we have an agency or organization that is the liaison between our office in Raleigh and the consumers and the clients in the communities that need assistance. So it may be a senior center, it may be a cooperative extension office, it may be a shepherd center or an aging agency. And so that information is on our website under How Do I Find SHIIP locally. And if you don't know who the coordinating site is, I know, Levita, you said you live in Pitt County now. Crystal Curran is our SHIIP coordinator, and I don't know if you know her, you're shaking her head. She's wonderful. And you've talked to her before? Yes, she is lovely and wonderful. Yes, so you're fortunate to have her there. And in Guilford County, I see Marianne, we have Senior Resources of Guilford in Greensboro, and Keith Slade is our coordinator. So at each coordinating site, that establishment has agreed to accept some SHIIP funds that we get from the federal government in order to carry out our mission locally. And that coordinator oversees our certified SHIIP counselors. And so that's how we operate, much like the tax assistance program. And so in some counties, the more rural counties, we're looking for counselors. If you're interested in learning about Medicare and then putting back out in the community, which I'll tell you is very rewarding, then reach out to us and we'll help you. We'll tell you what being a volunteer is all about and what it involves and what's required. We find out that former educators, you were a teacher, maybe, and they make great SHIIP counselors. And so reach out to us and let us know that you're interested in that, and we will be happy to help get that training ball rolling. And so our coordinating agencies are in most every county. In that agency is at least one person that is our SHIIP coordinator. And so that's how our program operates. And so people don't have to call Raleigh. They don't have to drive to Raleigh. And we know what that traffic's like sometimes. And it, again, is a very rewarding experience, whether someone assists you via phone, and we learned to do that during the pandemic, as our call center's been doing it since 1986. But we also can meet with people in our coordinating site or in a location that's convenient for the client and the counselor, and services are provided at no cost, again, and any medical or financial information that's shared is kept confidential. So this is a little bit about our program and who we are and what we do and how you can contact us. Carol, do we have any questions about SHIIP at this point? Okay.
I don't see any hands, no.
All right. Thank you, ma'am. So our next page talks about a program called Senior Medicare Patrol. And just like every state has a SHIP with one I to help people with Medicare questions, every state also has a Senior Medicare Patrol to remind people that unfortunately, there are people doing wrong and bad things out there. And I find myself often saying, these people are so smart to think of ways to commit fraud or abuse. Why don't they put their talents to something good instead of doing something bad that's harmful to people and wasteful to programs? So our Senior Medicare Patrol program, we have a separate program that receives a separate pot of money from the federal government, and our SHIP representatives or counselors are dual agents, if you will. So they're SHIP people that talk about Medicare, but they're also S&P representatives that remind people that there is fraud, abuse, and waste out there. It used to be that there were $68 billion spent annually nationwide or wasted on fraud and abuse, and that number's been knocked down to only 60 billion. And while that's significant, guys, that's still a lot of money. That's $8 billion decrease. That's wonderful, and we celebrate that. But $60 billion is too much. That's a lot of money, and we want to keep chipping away at that. So we remind people to do their part. And there's a motto for Senior Medicare Patrol: to protect, detect, report. Protect, excuse me, protect your Medicare card and your Medicare number just like you would a debit or credit card. Medicare numbers used to be in 1966 when Medicare started 60 years ago, your Social Security number with a letter at the beginning if it was railroad retirement and a letter at the end if it was Social Security retirement. And I kept saying, who thought that was a great idea to use your Social Security number as your Medicare number? Well, evidently other people thought that, and a few years ago they went to replacing the numbers, and now when they assign the number, it's not a Social Security based number anymore. It's randomly selected and assigned letters and numbers. And so even with that, if that gets in the wrong hand, people can file fraudulent claims. So we remind people, protect your Medicare card, even though it's not a Social Security based number anymore, like you would a debit or credit card. Detect. Look at your statements when they come out, again, like you would a debit or credit card statement. And Medicare, I used to work for Medicare before I joined the SHIP staff in 1996. And at that time, the statements for Medicare went out every month. And then they cut it down to where they were mailed out every 3 months. And a couple months ago, they started mailing out your Medicare A and B statements every 6 months. But if you have a Medicare.gov account, which we highly encourage you to create a username and password, then you can view your Medicare statements for A and B as soon as those claims are processed and they're in the system. So that's helpful. But they are saving money by mailing out statements every 6 months for Medicare A and B. But with that, there's a longer time frame of when you had something done and when you actually visualize how Medicare processed the claim. So to me, it kind of opens up the door for fraud and abuse a little bit more. But no matter how often those statements come out, open them up and look at them. And one of my funny stories that I tell, somebody said, I can't understand my Medicare statements. And I said, well, I'll help you, with them, bring them to me. And when they came, guess what? They weren't even open. And I said, well, it's kind of hard to understand it if you're not opening it. So open it up. And view it. There is a number there for you to call if you have questions. And if you still don't understand, you can always call 800 Medicare and they can walk you through. We can explain things to you by what you're relaying to us. We just don't have access to your claims history online. That's the only thing. So look at those statements. And then if something doesn't look right or you just don't feel good about it, then call your healthcare provider and question. Guys, they do things electronically through computers, but they're only as good as the data entry, and people are human, so mistakes are made. So call your healthcare provider, call Medicare, call your insurance company. And after doing those things, if you still don't feel right and good about it, reach out to our senior Medicare Patrol number. It's the same number as our SHIIP program. And so reach out to us and say, I've had this situation. If Trust your instinct and your intuition. And the thing is, if they're doing it to you, if they're frauding you, then they're probably doing it to other people. And I've had people say, well, it's only like $1. And I'll say, there's a lot of people on Medicare. And imagine if each one of those people was wronged by just $1, how impactful that would be to the system. So don't just let it go. Question it. And if it is something that you feel is not quite right, report that so that it can be investigated and it can be presented anonymously to the healthcare provider so that they don't know that you're the one that's calling to actually report it. Okay? So protect, detect, and report. And guys, as I'm saying this, I know some of you, I always enjoy presenting to your groups, and I do so at the end of the year when it's open enrollment for Medicare and the state health plan. But SMP and SHIIP, we do like to do presentations. So if you have a civic group that you're a member of, or you have a senior group at church, we love coming out and speaking to people. The more we get the word out, the better off everyone is. So any questions at this point, Carol?
Jeannie, what is your relationship to the state health plan? How would
That's a Yeah, that's a great question. So I always tell people when I ask, I usually go to Burlington and speak to Alamance County retired school personnel, and then I've got something set up for September later in the year, and there's a few others. And I always tell them when they want information about the state health plan, I am not the horse's mouth. Because I'm not directly the state health plan. That's Roberta and Jane, the PR people there. And I know that they attend your statewide conferences, but I'm not the other end either. I'm somewhere in the middle because we do work closely with the state health plan. And while I know where to stop and what's not in my driveway, so to speak, we do get information from them. They do trainings for us and our volunteers and our coordinators. So we do have access to information from them. And actually, Roberta Hamby, that's with the state health plan, used to be with SHIIP before she went to the state health plan. So she's, we've got a very close relationship with her and with Jane. And I do have my calendar open. And before I forget, you may know it already, but we found out that the state health plan open enrollment this fall is going to start October the 12th and go to October 30th. So the state health plan open enrollment period starts October 12th, which is on a Monday, and goes to October 30th, which is a Friday. So we've got about 3 weeks this fall when they present what our options are. And, keep your eyes and ears open in the fall for your decision guide to be mailed out. And I preach to people, I say, guys, you got to open that up. There's usually a little plastic sticky clear circle that holds the document together, but open it up and look at it. It's, a few pages, but it's very well written, I think. And the things that are important, they kind of emphasize and put in bold. But if you don't understand something or have questions, there are numbers on there for you to call the state health plan directly. We can give you indirect information, but if you have a specific question about the state health plan, that is your horse's mouth. It's not that we don't want to help you. It's just that we're talking about something secondhand rather than firsthand. And again, I kind of know where to stop and don't go past my limit. But if you call them, you're calling the direct source. So jot those dates down and be on the lookout in the fall because we have heard about some changes. People are asking me already about changes, and we've seen some proposals, probably like you guys have. We've learned with Medicare, people always say, I heard the Part B premium's going to be this next year. And I'll tell people until we get something official in writing from Social Security or the Centers for Medicare and Medicaid Services, we don't guesstimate. So we've seen some proposals for the state health plan next year, but until we get something official in writing directly from the source, we don't confirm or deny those. So, just keep your eyes and ears open for things that you see. And then in the fall is when we're going to start getting more definite information from the state health plan. Okay?
Jeannie, I think you have a question too.
Yes.
Pete?
Oh, hey,
Hey,
sorry.
Pete.
Hey, Jeannie, how are you? Um,
I can hear you a little bit. I don't know if you're
okay.
um
Can, can I, can you hear me now?
little bit better. Um,
Okay.
if you ask your question, and Carol, maybe you can see if you can help me, and if
It's in
not,
the
we can always
chat,
type it in the
Okay.
actually.
chat.
Yeah.
Okay, Pete, fire away.
So, my question really
Yes,
is about, you had mentioned the statements that you get from Medicare. So
yes.
what I was wondering is, can you set up to get notifications or alerts for activity so that you don't have to wait for a statement, but you can see things kind of happen as they happen?
So that's a great question, Pete. I know that you can that you receive notification about when your preventive benefits are available for Medicare Part B. Um, but as far as can you set it up to receive a notification like when you have a new summary notice, I don't know that for a fact, so I don't want to give you wrong information. However, I do know when I've gone to people's accounts in the fall for open enrollment, I've seen like a little bell with like a number one, almost like there's a notification there. So that makes me think that when something's there that's new, it may notify you. I reached out to Medicare the other day to ask them a question. Someone asked me, can you tell the Medicare that you want to get your statements electronically, but you want to get your Medicare new handbook paper via the mail? And so you're telling it two different things. I don't want everything electronic. I just want my statements, but my Medicare new handbook in the fall, I want that printed paper and mailed. So I called Medicare and I asked the customer service person, and they did not know. So I couldn't answer that person's question, and I don't have a Medicare account, so I can't go in and test that out. So I don't even know if you called Medicare, if they could tell you, but I do see in people's accounts when I go in there to help compare drug plans that there is, I think, a little bell with a number that tells them that they've got a notification. So that may be a possibility. That's a great question. I'm sorry, I don't know the definite answer to that. In a few years, I may know, but because I'm a state employee and hopefully the state health plan will have benefits for retirees when I retire several years from now, maybe, maybe I'll be able to find that out then. Thank you for your question. Any other questions, Carol?
Any other hands? No.
Thank you. So the third page of this Medicare Basics document, and guys, we use this document probably most than any other document. We use it for training our counselors and our coordinators. We use it when we do workshops and presentations like this, and we also use it when we counsel people individually. So the third page just tells a person when you're eligible for Medicare, you've got two options for delivery of your Medicare. Medicare Parts A and B with the red, white, and blue card that's been around since 1966 is on the left side. Part A is the inpatient or hospital part of Medicare. Part B is the outpatient medical part. And what's great about A and B Medicare is that you can take that to any place, to any healthcare provider, and as long as they accept Medicare, you're good to go. There's no network involved with Medicare A and B. The downsides of A and B are that there are deductibles and copays under both parts, so you would need to purchase separately and pay a separate monthly premium for a Medicare supplement or Medigap insurance policy. And a Medigap, the only function of that is to fill in where Medicare A and B leave off. It doesn't care what your retirement plan does, doesn't work with VA or TRICARE for life. Medicare supplements or Medigaps only work with Medicare A and B. And you would have a separate card for both. And because neither A, B, or a supplement cover outpatient prescriptions as of 2006, when Part D started, you would need a separate standalone Medicare Part D prescription drug plan, again, that you would pay a monthly premium for and have a separate card for. So on the left side of page 3, you'll see that you've got 3 separate cards. So we kind of say original Medicare and its components are a la carte. And you pay more upfront in premiums, but on the back end, you pay very little out of your pocket, depending on which coverage you have for supplements. So that's one option. And then on the right-hand side of the page is what we call Medicare Advantage or Part C. It's called Part C because it gives people a choice versus A and B Medicare. You still pay your Part B premium no matter what side of the page you're on. The only time you don't pay a Part B premium is if you have limited income and resources and assets and you've qualified for state assistance through Medicaid or a Medicare savings program, and the state pays that for you. Otherwise, everybody, no matter what side of the page they're on, they pay a Part B premium. And you all, very important, when we talk to clients, whether it's on the phone or in person, we screen them. We ask them questions about their money because, not to be nosy, we want to know what their money situation is, because if we think that they fall below that limbo stick, so to speak, then they may qualify for assistance, and we can do those applications right then and there. For Medicare medical services, if they qualified for any level of state assistance under Medicaid or Medicare savings, then that may help pay those A and B premiums, deductibles, and copays. And talk about very helpful to your pocketbook. Those programs are very helpful. For Medicare prescription drug cost, that program is called Extra Help, and that may help pay premiums and reduce deductibles and copays. So we do screen everyone for money information because we can do those applications. And talk about rewarding when you're helping somebody. It's rewarding for us when we help people apply and then they reach back out and say, I got my letter and I'm awarded. It can be life-changing for those people, helping them to pay for their groceries that they need, and these days to pay air conditioner to cool their home in these very hot days, but to also afford their medications and take them the way they're prescribed. And even in some cases, I'm assuming it's life-saving, because there's probably people not going to the doctor or not getting healthcare services and not getting their prescriptions the way they're prescribed because they feel they can't afford it. We try to see the big picture. If it can help you, be able to pay for what you need, whether it's, something that you need medical wise or food wise, or, just to keep you comfortable. Okay. Any questions about, and with Advantage plans on the right, guys, these do operate on a network of providers. So we are very upfront and honest with people about that. They see these commercials or they hear from your friends. I get some of my Part B premium paid. I get a catalog that I can choose free things from, and we all love free things. I love free things. We get fitness memberships. We get money for groceries, and I'm not discounting those things. They are great and they're helpful, especially if you're aged or disabled and on a limited income. But with that, we need to make sure that the provider network works for the Medicare Advantage plan you're looking at, and that your medicines are covered. Those are two important things. Then we can look at the other things that I call sprinkles on a cupcake. Okay? And with Advantage, you pay less upfront in premiums, but then you do pay on the back end in copays. Page 4 is a chart that outlines original Medicare Part A, the hospital or inpatient part, because many of you probably are not affected by this if you're a state health plan recipient, unless you have the state health plan with Aetna. Then if you have the Humana Advantage plans with the state, this is not applicable to you, but we do print this every year. We usually find out in November. And if you think about it, that means after the Medicare and You handbook has been printed and mailed, we get the figures for the A and B premiums and deductibles and copays. So you can look in that Medicare and You handbook, and I love that handbook. It's your owner's manual. If you have Medicare, you can look in that book till the cows come home and you will not find these figures. So as soon as we get them from that reliable source, usually in November every year, we revise this chart because we want people on Medicare to know what their out-of-pocket costs are, depending on if they're receiving inpatient services, which are on this page, and outpatient services for Part B, which are on this page right here. So I'm not going to go through that word for word. This document can be found on the SHIIP website. on the home page in the new to Medicare box, the Brady Bunch or tic-tac-toe box with 9 boxes, the one that says new to Medicare. If you click on that and look for Medicare Basics, this document is here, and we revise it every year for the current figures. Okay? And we want people to see that have original Medicare, those amounts in bold on the right in the you pay column. That's what makes a person realize I don't just need A and B alone. That's not enough. I do need something to fill in. And this chart does include the premiums, deductibles, and copays. So Medicare supplements or Medigaps, again, only work with A and B, original Medicare. There are plans A through N minus some letters. You'll notice E, H, I, and J are no longer available, and so they're gone completely. Plans C and F are no longer sold to new to Medicare beneficiaries as of 1/1/2020, and so they're pushed out to the side because if a beneficiary was eligible for Medicare before January 1, 2020, they can still purchase C and F. Now, I don't know why they would want to do that because those plans are no longer sold and the costs are going up and they will not go down. So they're there, but I don't know how helpful that is because I would not, I'm neutral, objective, and unbiased, but I'm also an advocate for beneficiaries. And I would say you probably don't want to look at CNF even if you're eligible to purchase it because it's going to be expensive. And because no new people can purchase those plans, that pool is going to shrink. And so we kind of just look at the A through N chart unless a person specifically asks about C and F. So under each plan A through N, you'll see the benefits that are checked. These plans were standardized nationwide back in 1992. And so what's under Plan A with the check mark, that's carved in stone. So you will never see an A plan with anything other than the checks that are listed. So an A plan is an A plan is an A plan, no matter what county or state it's sold in, no matter what company or agency or agent. These are carved in stone nationwide. Now, 3 states, Massachusetts, Minnesota, Wisconsin, do not have to abide by this chart because they had standardized plans in place already before 1992, and the federal government said, if it ain't broke, don't fix it. But you other states, including North Carolina, we had to adopt this A through, it used to be A through J, now it's A through N minus some letters, okay? And you do purchase these separately from an individual insurance company that's licensed by the state. In North Carolina, I think we have about 48 companies that are licensed to sell some form of these plans. And so we have a little database that if people are interested in comparing companies and plans and prices, we go to our database and we help people compare plans, companies, and prices for these supplements. Okay? And there's no network to worry about with these supplement plans. Medicare Part D, the prescription drug benefit that started in 2006. So for 40 years, Medicare was without outpatient prescription drug coverage. And so we were happy when the law was passed and when Congress said we will have Medicare drug benefits for outpatient. So that means if you go to the pharmacy or if you receive prescriptions as an outpatient at the hospital, day surgery, observation, emergency department, then the medications would be covered. The plans for Part D vary state by state. So what Pitt County, what Mecklenburg County, what Forsyth County has, Guilford County, that everybody in the state of North Carolina has the same list of Part D plans to select from. And that does change year to year. And that's why we encourage people to always compare their drug plan. No matter how you have your drug plan through Medicare or your retirement plan, compare that every year in the fall to make sure that your medicines are on that formulary or that approved drug list. Also compare pharmacies. That's very, very important. There is out of network, in network, and preferred, and that does make a big difference, guys. And you hear the word preferred and you think that's always better, and it should be, but it's not. So when we go in the Medicare.gov website and we can look at up to 5 pharmacies, and I encourage people to look at up to 5 pharmacies. You want to see what your options are. Sometimes preferred is not always the cheapest. But we would like to think that normally it is, but it's good to get an idea. So check out pharmacy options, to make sure that you're getting the best deal. Even if you take no medicines, we encourage people to have some type of drug benefit just in case. It's there just in case you need it. And also, you do not accrue a penalty if you have a drug plan of some sort. And there's a plan in North Carolina, I think it's about $3.60 a month, $3.60 a month premium, that's very affordable just so that you have a drug benefit in case you need it and you're not penalized later on. Okay? So that's Part D. Again, the plans vary state by state, and they do change every year starting in January. So if you know someone or if you have a Medicare drug benefit, then please make a note on your calendar from October 15th, excuse me, through December 7th every year to compare your plan. It's just that important. And you all, my husband hears me since I've been doing this since the fall of 2005. So for 20 years, I've been helping people compare drug plans. And I tell my husband, open enrollment for me is like I'm an accountant during tax season. And it's stressful and it's long hours, but when people don't come in to see us, I worry about those people. I'm like, are they getting the best coverage at the best cost? So we want to help people. They can always call 800 Medicare, which is open 24/7. There's agents out there that those clients are already working with for something. So reach out to someone. And again, even with the state health plan, compare your drug benefit options for the base or the enhanced Humana plan as well as the Aetna 70/30. Okay? And then Medicare Advantage at the bottom of page 7 talks about Part C, which gives people a choice. They do operate on a network of providers. HMOs are very restrictive. When I talk to people about Advantage plans, I'll draw a circle on a piece of paper and I'll keep going around and around and I'll make it a very distinct boundary. So if you join an HMO, you are in that boundary of network providers that insurance company has contracted with, and you can't go out of that circle. Well, you can go out of that circle, but if you do, you're going to pay. The plan will not pay. So you have to stay in that network if it's an HMO. A PPO wants you to stay in network and see network providers, and if you do see providers that are contracted in network, you pay a copay. But a PPO has a dotted or broken line outline allowing you to go out of that circle. And if you do that, which you were allowed to do with a PPO, you just have a higher copay. And so if you're in a PPO, you will get an outline of benefits with an in-network and an out-of-network copay because that PPO is a little bit more flexible than that HMO. These are medical plans, and they more often include a drug benefit. So if people want medical and prescription drug coverage, they can get that with an Advantage. Again, you pay your Part B premium in most cases, unless you've got limited resources and incomes, and the state pays that for you. And these again provide some of those sprinkles: dental, vision, hearing, fitness memberships, maybe some of your Part B premium back or money for groceries. But you got to make sure your provider network works, and you got to make sure that your prescription drugs are covered to have that cupcake. And then the rest of the things on top are sprinkles that are nice to haves. Okay. With Medicare Advantage, you pay less upfront in premiums. Some Advantage plans, because they get a capitation fee or an amount from the government every year for each person they enroll, each month, I'm sorry, that they enroll someone. And so they pass the savings on to the beneficiary. So some Advantage plans have zero premium. You just pay your Part B premium for Medicare, you pay no premium for the Advantage plan, and then you pay your copays on the back end. Advantage plans also have out-of-pocket maximums per year, and certain services that you pay a copay for, that copay applies towards your annual out-of-pocket maximum, and that's very, very important. So Medicare Advantage plans are good options for people. And for disabled people that are under 65 on Medicare due to disability, it might be their only option because supplements are more expensive for disabled people and the plans they can select from are limited. In North Carolina, if you're disabled on Medicare, you can't get all of those A through N plans. You can only get plans A, D, and G, and the premiums are very expensive. So most of our disabled beneficiaries go with Advantage plans because they're affordable. And then when that disabled person turns 65, they have a new Medigap open enrollment that they can get any supplement A through N, and the rates should go down, making them more affordable. By that time, a Medicare beneficiary, when they go from disability under 65 and then they turn 65, a lot of them are situated in an Advantage plan and they understand how it operates and it's affordable. And many people just stay in those plans, and that's fine and good. But when a disabled person turns 65, they have a new opportunity to look at the big picture, and we want them to come back to us to do that. Medicare drug plans vary state to state as far as the list that comes up when we do the search. Medicare Advantage plans vary county by county. So again, what Pitt County has and what Forsyth County has or Wake County is different than what we have here in Guilford County. And when you do a search on Medicare.gov, it will tell you in your county that your zip code has been populated, how many plans there are, and what those plans or who those plans are. Advantage plans are good options for some people. We want to make sure that when people hear from their friends, oh, I get money for my groceries, and we do the search, and we want to make sure that a person understands and knows what they're getting into, and they know how those plans operate. We want them to be a smart, well-educated, informed consumer, especially when it comes to Advantage plans, because getting in the wrong plan can be very detrimental. Okay. Any questions at this point, Carol, before I hit the last page of this document?
Any questions?
I'm typing one, but just go ahead.
Wonderful. Thank you.
Yeah, just go ahead, and then when I finish, I'll send it.
Sure. Thank you. And Carol, just let me know, okay?
Okay.
So the last page of this document is preventive services. And we want everyone to know, even if you're not on Medicare, no matter what type of insurance you have, what your age is, taking advantage of the preventive benefits that your health insurance offers is very, very important. Most of the plans have no deductible to meet and no copay. So if it's a preventive benefit that you're going in for routine maintenance, just like your car, we take our car in every 5,000 or 7,500 miles or 3,000 or whatever, just to make sure that our tires are good and that our oil filter's good and our oil's clean. And you all know sometimes you've taken it in for routine maintenance and they say, well, I'm so glad you brought your car in because we found that this belt had a problem and needs to be replaced. And so instead of you ending up on Interstate 40 with your hood up or with a flat, they caught it before it became a problem. So we remind people of these preventive benefits. In fact, we get a special pot of money to remind people of these preventive services and also to screen people for assistance programs because the government knows just how important these two things are. If you get a Medicare New Handbook, whether you get it electronically on Medicare.gov or you get it via paper in the mail, you get one per household in the fall. Pages 30 to 55 have a little blue apple on some items, and we know what an apple a day does. So if you see a little blue apple between pages 30 to 55 of the Medicare New Handbook, it's a preventive service. And this is only an alphabetized checklist. In the Medicare New Handbook, it gives you more information. Who can get it? How often can they get it? What are the requirements and everything? And if your healthcare provider codes it when they submit it to Medicare in the right way, then these services should be covered, usually with no deductible to meet and no copay or anything to pay on the back end. So I can't afford it should not be a good excuse for people to take advantage of these preventive benefits. Okay. And then I've got one more thing, and I'm going to see if I can get this from our website. I may have to stop sharing and then share again. But when we talk about, we just jumped right in, but who's eligible for Medicare? Most people like to think of the age, and it's 65. That's the magic age. And every year I get closer and closer to being my own client. Hard to imagine, but we want people to know about us before they need us. And we do have this special 4-page document. And Carol, can you see this Road to Medicare document?
Yes, I see
Oh,
that.
wonderful. I show a green outline, so that's a good sign. So this document is for those people that are turning 65. So we kind of queued it up a little bit and call it Planning Your Drive to 65 towards 65. When I speak to groups and I ask people, when you think about turning 65 and go on Medicare, what are some feelings that you have? And people will say confused and overwhelmed and concerned and scared. We hear lots of things, and we don't want those negative feelings. We want you to know that SHIIP is here to help. You're not in this alone. And we want it to be a good, positive experience transitioning to Medicare eligibility, because Medicare does offer good coverage, and it's affordable. So we want you to be excited about it and embrace it. So we developed this 4-page document several years ago. And on the first page where you see the bold bullet points, these are the headings throughout the next few pages. When's the best time to reach out to SHIIP for that neutral, objective, unbiased assistance at no cost? About 3 months before you're turning 65. And people reach out to us before that, and that's great. We want you to know about us before you need us. Don't wait till the last minute. But if you reach out to us more than a year in advance, we're going to say, when do you turn 65? Come back about 3 months before that. Put that on your calendar. I've got friends and neighbors that are reaching out to me, and I'll say, when's your birthday? When do you turn 65? And it's on my calendar when to reach back out to that person. Because about 3 months is the right time for us to look at what your options are, especially if your birthday is like the first of a year when everything's changing and the new figures are coming into play. So this document talks about when it's good to plan. Again, don't wait till the last minute. We tell you what your options are. We have the enrollment periods for Medicare A and B. If you're already receiving a Social Security retirement benefit, and when is the youngest age that you can collect retirement from Social Security? 62. But when you collect at 62, what kind of benefit is it? It's a reduced or partial benefit. And so you can start drawing your Social Security at 62. The full retirement age, I don't know if you guys remember, used to be 65, which was perfect because it lined up with Medicare eligibility. Well, we all hear Medicare's in trouble, Social Security's in trouble. It's fully funded until I think 2034 or something. I don't know. And I say it like that because I've heard that forever. When I worked at Medicare in the early 90s, I heard that. And here we are 30 some years later. The government knows how important Social Security is and how important Medicare is, and they have actuaries that are actually planning how can we keep these programs afloat. So one thing that they did several years ago, and I remember I was at AHEC in Greensboro when I heard this, they were increasing the full retirement age from 65 to 67, depending on your month and year of birth. So you can still start drawing at 62 at a reduced or partial rate, but you may not be eligible for full retirement benefits until 66 or 67, not just 65. And so if you're receiving that Social Security retirement benefit, or a disabled person that's applied for Social Security disability and it's been granted, they have to be receiving 24 months worth of Social Security disability checks, and then their Medicare starts in their 25th month. When you're getting that Social Security check, retirement or disability or railroad, when it's your time to go on Medicare, they should mail you your red, white, and blue card about 3 months prior to your Medicare eligibility date. And so when you get that card in the mail, that's a good time to reach out to us, because then we have your number and we can go in the system and look at things and do things live, okay? Make sure that your address is correct with Social Security so that when they're mailing things out, they're going to the right place. Now, if you're not automatically enrolled, And you will get a little packet. It's a booklet called Welcome to Medicare, I think. It's an abbreviated booklet of the road to Medicare, but your card comes with it, and that little abbreviated Medicare handbook comes with it and has a lot of good information. The initial enrollment period is for people that were not automatically enrolled. They're not receiving a Social Security check. It straddles your 65th birth month. It's the 3 months before. That's the soonest you can enroll in Medicare, not the 4th month before. And if you enroll 3 months before, that's the best time. Then your Medicare starts the first day of the month that you turn 65. The exception to that rule is if we've got anybody here today, your birthday's the first day of the month, it backs everything up. So for example, if your birthday was July 1, your Medicare would have started June the 1st. So your 3 months would have been March, April, May that you could have enrolled. Your Medicare would have started June the 1st for your July 1st birthday. And it's only if your birthday is the very first day of the month. You can enroll the month of your 65th birthday, but your Medicare doesn't start till the month after. So you've kind of just wasted a month of Medicare eligibility. And then you have the 3 months after. And if you enroll in 1 month, your Medicare would start the first day of the month after that. Medicare only knows to start the first day of a month. And if you're not if you are not automatically enrolled, or for whatever reason you don't take advantage of initial enrollment, then there is a bus that comes around every year called general enrollment. Social Security will tell you there's not a lot of people that enroll during GEP, but I tell people the bus comes around, and if you were not automatically enrolled and you did not initially enroll when you turned 65, you can get on this general enrollment bus from January 1 to March 31st, and whenever you enroll that month, your Medicare will start the first of the following month. Now, you may be penalized for each 12-month period that you could have been enrolled in Medicare, but you were not. But at least it gives you opportunity to enroll if you did not have automatic enrollment and did not participate in initial. The exception to that is people working past 65. Either they, the Medicare beneficiary themselves, or their spouse has active group insurance, and they might not need or want Medicare. They might not need to pay that Part B premium for secondary coverage that really isn't going to pay that much. So when we screen people, we ask them, are you actively working? If so, are you going to retire? And if so, when is that? Do you have group insurance through yourself or a spouse? How many employees are there? And so we ask a lot of questions. Is your employer plan in the form of a healthcare savings account? So there is a time frame called special enrollment for those people that become eligible for Medicare but do not take it out, Part B, because they have active group insurance through themselves or their spouse. And so we know the questions to ask to make sure that we're helping people set up appropriately for that. Special enrollment for Part B is an 8-month window when their employer plan stops altogether or stops being primary. And if it is in the form of an HSA, a healthcare savings account, that's very special, guys. So we refer people back to their HR to determine when they want to take out their Medicare, and then they come back to us. Because if you have your health insurance at work through the form of an HSA, and they're becoming more and more popular, then you can't contribute to that HSA if you start any part of Medicare. You can only withdraw, and there may be tax repercussions. So that's a question that we've started asking over the past several years when we screen our clients. This document talks about supplements, and it talks about Part D, employer or military retiree. We have people that are retired military that have TRICARE for life, which is awesome, but they need Parts A and B as primary to that TRICARE for life. The TRICARE has medical and prescription drug coverage. They don't need anything else other than A and B and their TRICARE. And for VA, that is not a health insurance. That is a benefit for someone that was a veteran. We highly encourage that they take out Parts A and B as well. You can't, A and B Medicare and veterans benefits, they don't coordinate, but it does give a person a flexibility or choice as to where they receive their services. A person that has VA prescription drug benefits can also have a Medicare drug plan. And so we talk to veterans about what their options are. Medicaid or Medicare Savings, that is a federal program that's state administered, but on a local county Department of Social Services level, that's where people do Medicaid applications and Medicare Savings Programs applications, and these people have to have limited incomes, resources, and assets. And it talks about Medicare Advantage Part C as well. It gives important phone numbers for some of the partners that we work with and refer our clients to, again, if we're not the appropriate source to help people. So I'm going to come back and I'm going to stop sharing my screen. And do we have any last minute questions? An hour goes by so quickly, but do we have any last minute questions or comments, Carol?
There are a couple of questions in the chat, Jeanie.
Okay. And let me see. Do you want to filter those to me, Carol?
Fleming says he's a 74-year-old who was recently diagnosed with as a type 2 diabetic. Which supplement would you recommend to cover perhaps his additional medical expenses?
Hey, Fleming, thank you for your question. So I do have a question for you. What coverage do you currently have? Are you a state retiree, eligible for the Aetna 70/30 and the Humana basic and enhanced plans? Can you share with us what type of coverage you currently have? Because normally, when you're diagnosed with things like that, and being a diabetic is important, it can also lead to other health conditions and problems. You can't normally just change or add because then you're at risk. Like for a supplement, if you try to apply for a supplement now or change supplements and you've just been diagnosed with being diabetic, that's probably going to be very difficult. But can you share what you currently have now?
You'll need to unmute, Fleming.
It's not red, so I don't think he's muted. All he just needs to do is speak up.
Or type it.
Can
You
you
can
hear,
type
can
it
you
in.
hear me?
Oh,
Can you hear
yes.
me now?
Hi.
Go ahead. Go ahead.
I think I put the question in the chat. Did you see the question?
We saw the question, but I
Okay.
need to know what you currently have. Are you a state retiree?
Yes.
So do
Retired high
you,
school employee.
okay, so do you have the Aetna 70/30 plan with original Medicare, or do you have one of the Humana Advantage plans with the state?
Humana Advantage plan for the state.
Okay, so normally you can't just up and change those in the middle of the year because you have a new diagnosis. You're going to get your decision guide in the fall for next year.
Okay.
You can reach out to the state health plan because you have one of those Humana plans and talk to them now. But again, you can't just up and change plans in the middle of the year. They're going to tell you that. But what you can do is you can make sure that the medication, if your doctor's writing you a new medication or prescription, is on your formulary with the Humana plan and that you're going to the appropriate pharmacy. So I would encourage you to maybe reach out to the state health plan. There's a number on your Humana card. Either call the state health plan or Humana directly that's on your card and share what you just shared, and make sure that the medicine that you've been prescribed is on the formulary, and make sure that you're using a pharmacy that you're going to get the best cost for. Does that help?
Okay. It does. So if I was thinking in terms of a supplement to what I have now versus changing it completely, just
And if
adding.
you've got one of the Humana Advantage plans, you do not have a supplement. You have a Humana Advantage plan. That is a Medicare approved Advantage plan, a Part C. But the good thing
Yes.
about it is if it's being offered by the state, there's no network that we talked about earlier. With the state health
Yes.
plan, Humana, it's an open or passive network, so you can see anybody. There's no conforming circle.
Mm.
And I tend to think, guys, and I'm neutral, objective, and unbiased, but I worked as a state employee. You earned the right of state health insurance. There's people that are hired now, they don't get that when they retire. So we're very fortunate. And I tend to think that the Humana base and enhanced plans are good products. The state health plan and Humana would tell you the difference between the base and the enhanced, and those premiums
Mhm.
are different, is that the enhanced formulary for medicines is different than the base plan. The medical benefits are pretty much a given and evening, but what makes the enhanced different is the formulary for medicines. But I would encourage you to reach out to Humana on your card, the number's there, and share with them what you share with me. And if you know the name of the prescription or prescriptions that you're getting related to your diabetes, share that with them so they can look that up and make sure that you're going to a pharmacy that gives you a good cost in the network, okay?
Thank you very much. I appreciate that.
You're welcome. Thank you for your question.
Linda has a question.
Hi, Linda.
Hey, yeah, my question, you were referring to the money that comes from the federal government to pay for the Medicare Advantage plans. And so it's basically going to, I guess, a state health plan, and that's how, we have the Humana Medicare Advantage plan. And up until now, we didn't pay with the base plans. There was no premium. We had only with the enhanced plan. Well, this year we're going to have the base plan is going to have a premium, and the enhanced plan is going up. So I was wondering how much they paid per person, and then there's been some type of cut in funding. Was that because of the big beautiful bill or something going on up there in Congress?
Yes, Linda, thank you for your questions. And those are questions I can't answer because I'm not the horse's mouth. I know to stop at this point because that's not my product, so to speak. I will tell you that the capitation fee that Advantage plans receive from the federal government does vary from plan to plan, and I don't know what the agreement is between the state health plan and the federal government. So again, that's a state health plan question. And I did see where something popped up. I can certainly do a presentation virtually. And just keep in mind, guys, what we're seeing, those are proposals. They have not been carved in stone yet. So when I speak about those, I'm not being definite because we don't know for a fact. That's what we're thinking, but those are proposals. And so once we find out that, yes, these figures are real and accurate, then we can address those. But the questions that you have, I think, are state health plan questions. And guys, when I do these presentations, I preach, look at your decision guide when it comes out. I get one. Mine's for active employees. I get one. I open it. I read it. It's very easy to understand. You just have to open it and look at it. And if you don't understand or you've got a question, there's a number on there for you to call directly to the state health plan. Don't just dig your head in the sand and pretend it's going to go away. Really open that up and look at it. The state, think of it this way. Think of when you were a teacher and you put something into something for your students and then they didn't even use it. And you're like, guys, I put all this time and effort. That's how I look at it. They put those decision guides together and they really try to be mindful of presenting the information so that we can understand it. So at least do them the respect of opening it up, looking at it, calling if you have questions. And so maybe they're increasing the rates for the premiums for the base and the enhanced, even after they get money from the government because they want the program to be viable for years and years to come. I hate it that newly hired employees don't have access to health insurance from the state when they retire. I just think that's awful. That's a benefit that I've worked for and that I appreciate. But I also know that I've counseled people, and we are fortunate, guys, because I've counseled many, many people that when they retire, their health insurance stops right then and there. They slam on the brakes, or they let them continue their health insurance, and then when their Medicare stops, they slam on the brakes. We are fortunate up until a couple years ago that when we retire, our health insurance continues, and it even continues into Medicare eligibility. So that's a great benefit. There are many, many people that don't have that, and it's very sad. So we're fortunate. So if they do raise the premium a little bit, and I get it, my premium's probably going up as an active employee, but when I look at other people's situations, I'm not in such a bad situation myself. So we have to keep that in mind, and we don't like things increasing and we don't like change, but for future generations to have the coverage and it be good coverage. And I heard that it's proposed that we go back to Blue Cross Blue Shield in 2028 rather than Aetna. So I think they're just looking at things and trying to make good decisions on our behalf. But you're a collective group. You talk to your representatives. We're closely related to RGEA, and they've got a lobbyist, and I know CNAC. So work with groups to voice your opinions and your concerns. But we state employees and retirees, we're in pretty good shape, I think.
Well, Jeannie, I would love to thank you so much. There are accolades in the chat box saying what a great presentation you've
Thank you,
given.
guys.
And I knew you would not disappoint in presenting information. And I know you were trying to fly through to get it all in there. And I do appreciate that. And I have good news for some that I've already answered in the chat. We actually have Roberta Hamby coming for our Wednesday workshop in September. So if you want to tune back in for Roberta with the changes in the state health plan,
Yes.
she'll be here